So, update on Chim. Chim had 2 surgeries in the last 2 years on his knee. We were making great progress. In this last week, it took a turn for the worse again. He has pain below his kneecap on the medial side. He also has pain behind the leg. But the real problem is he can't straighten the leg to 180 degrees. It doesn't totally lock straight, and that's causing a lot of pain and discomfort. So the first thing I notice is the leg is short, and I'm going to test the medial ligament, the medial collateral ligament, and that actually helps. So we're going to do that first adjustment where we contact and we adjust mostly inferior, and we also do the medial heel or ankle at the same time, and that helped a lot. That actually it made the legs go even. So now we bring it up into position 2, it's still even. Now we're going to go through a lot of detail on the knee. I'm going to push the knee forward, which is anterior. That showed up. So I'm going to bring his leg up, come to the top of the tibia, and adjust it from anterior to posterior. Let's recheck what we just did. I push forward, it's good. Now I'm going to take the leg and rotate it internally, and that made the leg go short. So let's see if that needs to be corrected. We're going to correct it with an external rotation, and come right on the inside and kind of turn it back externally but to the midline. And that worked. Let's stress it again, and that's fine. Now I'm going to do a kind of a shearing motion, like a valgus varus, and that helps too. Okay, so we're going to adjust above, actually the femur, just above the knee and just below. So I'm bringing it back to the middle again. And let's see if that worked. It did. Next we're going to grab the fibula and we're going to pull it superior and posterior, and that made the leg go short again. So we're going to adjust it anterior, a little anterior and inferior, and that worked. He's had kneecap misalignments. So first I'm going to stress the patella medially, and that's what we saw a few weeks ago when he had this similar type of pain. So that did recur. I'm going to put on a very low setting because the patella is you just need a gentle tap for the patella. And let's recheck that. So we're checking for the medial displacement, and it's balanced now. And now we're going to pull the kneecap inferior, and that again showed up. So in a minute I'll have him turn over and I'll adjust it from inferior to superior, and then we'll check his ability to have extension without pain.